Peace be upon you and God's mercy and blessings. Without any introductions, let's get straight to the point. What are the early, common warning signs that must never be ignored, especially the sign that matters most to women? And how can we make up for a deficiency? All of this and more will be explained in this video. Early and common signs of vitamin D deficiency. If you want to avoid a deficiency, you must recognize its early, frequent warning signs. Here are the most common, starting from the earliest. 1. Unexplained fatigue and persistent tiredness. Modern lifestyles, indoor work, crowded cities, poor diets, limit sun exposure and nutrients, leading to low vitamin D. Vitamin D drives energy production in mitochondria of nerve and muscle cells and regulates calcium inside muscles. When levels fall, energy drops and fatigue persists even after long rest. Clinical studies, 2014 to 2018, show that people with unexplained fatigue often have vitamin D below 20 nanograms per milliliter, and symptoms improve significantly after supplementation. 2. Bone, joint, and muscle pain. Low vitamin D reduces calcium absorption by 30 to 40%, forcing the body to draw calcium from bones. This causes lower back, hip, and chest bone pain, skeletal deformities, muscle weakness, especially in thighs and arms, heaviness in limbs, and cramps. It can lead to osteomalacia in adults and rickets in children. 3. Weak immunity and frequent infections. Recurrent colds, respiratory infections, skin infections, urinary tract infections, and viral illnesses like herpes can all indicate deficiency. Vitamin D regulates immune responses, stimulates antimicrobial peptides, and balances T and B cell activity. Studies, 2017, 2020, found that low vitamin D increases the risk of respiratory infections by about 40%, while supplementation reduces that risk. 4. Hair loss. Notable hair shedding, overall thinning, or delayed regrowth, especially in women, may signal low vitamin D. Vitamin D regulates keratin production and activates hair follicles. Its deficiency keeps follicles in the resting phase and promotes inflammation of the scalp. Research in 2020 showed significant hair regrowth within 3 to 6 months after correcting the deficiency. 5. Excessive sweating, head and face. Often first seen in infants but possible in adults. Vitamin D influences the nervous system that controls sweating. Low levels can overactivate the sympathetic nervous system and lower calcium, causing sweating, muscle cramps, and tingling. 6. Mood changes and depression. Vitamin D boosts serotonin, happiness hormone, and affects dopamine. Deficiency increases brain inflammation and can disturb melatonin, causing sleep problems and raising depression risk. Multiple studies link low vitamin D to seasonal affective disorder and winter depression, particularly in northern regions. 7. Poor concentration and brain fog. Symptoms include forgetfulness, slow thinking, and difficulty making decisions, common in the elderly and in people with obesity. Studies, 2020, show cognitive functions improve within weeks to months after supplementation. 8. Slow wound healing. Vitamin D regulates collagen production, stimulates skin-repairing keratinocytes, and promotes new blood vessel growth. Deficiency weakens these processes and delays healing, as shown in clinical studies on oral surgery wounds and diabetic foot ulcers. Correcting vitamin D deficiency. Treatment depends on severity and overall health. 1. Sun exposure. Best time, between 10 a.m. and 3 p.m. contrary to old beliefs. Duration, about 10 to 30 minutes, 2 to 3 times a week, exposing as much skin as possible, arms, legs. Darker skin, sunscreen use, and windows all reduce vitamin D production, so people with dark skin or those who stay indoors should get longer or daily exposure and limit sunscreen when possible. 2. Dietary sources. Natural foods, fatty fish, salmon, tuna, sardines, egg yolks, beef liver, butter, full-fat dairy. Fortified foods, milk, orange juice, and fortified breakfast cereals. 3. Improve absorption. Take vitamin D with a meal containing fat, such as olive oil, full-fat yogurt, or avocado, for better absorption. 4. Supplements, under medical supervision. Because there are conditions such as liver disease, kidney disease, obesity, or intestinal malabsorption affect vitamin D levels. And because magnesium is essential for activating vitamin D. Supplements can interact with certain drugs, e.g. corticosteroids, seizure medications. Excessive doses may cause toxicity, high blood calcium, nausea, kidney damage. Dear viewers of Medical Capsule, you now know the key early signs of vitamin D deficiency. If you or someone close to you experiences any of these symptoms, see a doctor for proper testing and treatment. Please share this video, it may help someone regain their health. And remember to subscribe and enable notifications so you don't miss our next health topics. Write in the comments the health issues that concern you most, and we'll address them in upcoming videos. Until next time, may you remain in God's care. Peace be upon you all.